6 minutes past the hour. Welcome to the Nation Leadership Forum. Remember, you can continue and follow the conversation online on all our digital platforms, and the hashtag is NMG Leadership Forum. Tonight, we are looking at something very, very special, COVID-19, but that's not what is special. What is special is we are also looking at how we're going to be helping the vulnerable in our society, and I have a panel of 6. It's a full house tonight. Earlier, we were speaking to Simon Chelugui, who's the CS Ministry of Labour and Social Protection. We also spoke to Fauzier Ali Kimanthi, who is the head of Digital Products and Services, Safaricom PLC. Also, we have a bishop who is Joseph Obanyi Sagwe, who's the Bishop Catholic Agencies for Overseas Development, CARFOD. We haven't spoken to 3 of our panelists, so I want to go straight in, to talk to Kate Minavoli, who's the Country Director, Plan International Kenya. Kate, in your opening remarks, I also want you to include your scorecard, how we've responded as a country in responding to the challenges of the vulnerable in our society during this coronavirus pandemic on a scale of 1 to 10 with your opening remark, Kate.
Thank you. Thank you very much, Dennis. In terms of the score, I would be bold enough to say, because the question is linked to the extent that we are responding for the ultra vulnerable groups, I would give Kenya a score of 7. That doesn't take away the great leadership, the decisiveness we have seen from our government, the solidarity from different stakeholders coming in to be part of the response, the UN family, the civil society, private sector, and just the leadership we've seen from different line ministries. So, but that score is related to the specific question around our vulnerable groups. And I'm reminded of what the United Nations Secretary General said as he launched the COVID-19 Global Humanitarian Response on 23rd March. He said, and I quote, "We must come to the aid of the ultra vulnerable, millions upon millions of people who are least able to protect themselves. This is a matter of basic human solidarity. It is also crucial for combating the virus. This is the moment to step up for the vulnerable." You know, Dennis, these are really abnormal times. If there was ever a time that Kenyans need to come together for the most vulnerable and for the socially excluded, this has to be it. As Plan International, we've been working in Kenya since 1982. We've been working at the community level. We consider ourselves grassroots, working where the need is at the greatest. So we're working with communities, we're governments, both national and at the county level, to raise awareness about the importance of children's rights. As Plan International, we are relentless in driving change for children, and particularly change for girls. COVID has definitely changed the environment in which children are living in. There are gender dimensions to this pandemic that we are only beginning to understand and to grapple with. As Plan, we believe in listening to the girls. And last Friday, we had a Twitter chat. It was dubbed Linda Siste, and we were able to listen to girls. This was in partnership with Inua Dada, and we had fabulous feedback from girls in terms of how COVID is impacting them. They need hand washing facilities, and they need them like yesterday. They need sanitary towels. They need to be able to manage their menstrual hygiene. They are experiencing and are fearful of sexual violence, sexual assaults, and gender-based violence. And they want to be able to access health services like sexual reproductive health rights. These are the voices of adolescent girls and young women. So to the extent that our response is not 100% inclusive, is not listening to our ultra vulnerable, I think we can do more. And I think we have the capacity. Indeed, I believe in Sub-Saharan Africa, Kenya is leading the response. And so there is more we can do to ensure an ultra-inclusive response to our ultra-vulnerable.
Well, thank you very much, Kate. Thank you very much. You've used a new word there, ultra-vulnerable, but then you've also mentioned matters to do with gender dimensions, and that's going to be forming part of the questions that I'm going to be asking the other panelists. But I want to go straight to Kennedy Odede, founder and CEO, Shining Hope for Communities. Kennedy, your scorecard, and please, because of time, we want to go straight in. What has been the role of communities and the youth in responding to the current COVID-19 pandemic in the vulnerable societies? What have you observed?
Thank you so much, Dennis. And you talk about the government. I think the government is also doing an amazing job. As you see, the president is trying his best to ensure that things are happening. But to be told, the ground is different. I was in Kibera and Madare, and I saw people are not wearing masks. We have health clinics. We have in the communities between Madare and Kibera, and they're not being taken advantage of. I thought by now the government should have taken those places to be a place of isolation, but nothing has happened. People are told to wear a mask by force, but there are no masks, and they want food. And at this moment, we're in a situation whereby it is tough because right now people are hungry. They want food. It's about starvation. And for the first time, we realized that we should be taking care of informal settlement. We should be upgrading it, because right now, the way things are, it's becoming difficult. We got that we have almost 5 cases of coronavirus in Kibera, and I'm really, really scared how many people are going to get infected. So I think right now, the government should really work with the community. Things need to go on the ground. The money that is being released should go on the ground. People are hungry. We are asking that, where is the cash transfer going? We want to see the people who are saying they're getting money, So these are the things that we need to work on. As Shofco, what we're doing right now, we're making sure people are washing their hands. We provide clean water. We also give them soap, because right now is about basic needs. The rest they can take care of. What they are asking for is basic needs. Clean water. They are asking for food. And the best way is to do the cash transfer, believe me. So that's where we are. Right now we have used our facilities, and we have over 3 million uses. People have used the hand wash stations that we're having. And we're also giving people 400,000 soaps in the households. That's what we're doing in the community.
Well, thank you very, very much, Kennedy Odede there. It's tough, rightly, you've put it rightly, the cash transfer issue. We're going to be speaking to the CS about that, but I want to bring in now Honorable Mohammed Gabo, who is the Executive Director, National Council for Persons with Disabilities. Mheshimiwa, what are the challenges that the PWDs are experiencing now with the COVID-19 pandemic in the country, and the challenges that you've had Kennedy mentioned, are those the same challenges that you've also observed as you're running this agency?
Thank you, Akai. The problems are similar in every sector. But again, for persons with disability, it is more pronounced. Let me just talk about the transport issue. People with disability who are on wheelchairs, they seem not to be able even to board matatus. We do not have pathways where they can also freely move with their wheelchairs. We are talking about washing our hands, but basically we find that the hand washers are high. A person with a wheelchair, again, short stature person, cannot be able to use that. Persons with disabilities have been asked to stay at home. Most of them are people without a job. Some of them need assistance. For example, wheelchair users, the blind, the deaf, all these need guides. Social distance is a big problem to them because they have to move around with their assistants. So basically, what we suggest is that persons with a disability currently are the worst affected. But I'm glad the CS has said that we are able to give them cash transfer. So over 47,000 households are on cash transfer. We are also trying to identify another 9,000 persons or households which will make sure that they'll be able to get an extra amount to cushion them from this effect of COVID-19. So we really need to ring fence some funds for them, because if they are allowed to compete with the rest of the community, they may not be able to receive everything. For example, the president has announced the 10 billion Kenya shillings. We must be able to get some funds for persons with disability from that. We ring fence and say this is left for them, because they cannot be able to run around looking for chiefs and others to be able to assist them. Built environment is a big issue. And I've been asked at the moment, right now I've been asked, do we have a sign language interpreter in this TV show? We've just logged over 400,000 persons with who are hearing impairment, cannot listen to us. So we hope we'll be able to communicate all this information in a way that persons with disability can be able to receive them. Otherwise, we may be talking to them while actually they are not able to listen or follow us. Thank you, Okari.
Well, thank you very much, Honorable Mohammed Gabo. You've just thrown me under the bus right there, but I'm sure somebody is taking notes, and that point has been will be taken into consideration most definitely. Before we go to a break, I want to bring in Bishop Joseph Obanyi-Sagwe one more time. Remember, it's the Catholic Agency for Overseas Development, CAFOD. And Bishop, in these trying times, what is the church doing? Because many are accusing the church of saying they won't go back to the normal services because of offerings and the tithes and everything. But in light of what Mheshimiwa has just said, what is the role of religious organizations in catering to the wholesome needs of the vulnerable in our society? And to start off with those persons with disabilities, Bishop.
Thank you, Dennis. I will say that the church, as I said at the beginning, is very well and much involved in the activities that are going on. Apart from, the churches having been closed, as we have always said, the hearts of the people are not closed. And the church is very much in contact with the people through messages of hope, messages of spiritual care, and even sometimes taking care of their needs. CAFOD works in many parts of this country in partnership with the Catholic Church. It's working in 8 counties at the moment: Nairobi, Marsabit, Isiolo, Samburu, Kitui, Mombasa, Homa Bay, and Kajiado. And this is CAFOD. And we have other agencies like Catholic Relief Services. We have the Catholic Justice and Peace Program. We have the Caritas Kenya. On Saturday, they were able to take relief needs and goods to the people in Kibera. We have had the Archbishop of Kisumu, Caritas Diocese of Kisumu, also taking care and going to visit the disabled, those people with disabilities. We have our people having been mobilized, our Christians, to start contributing towards the help of the vulnerable groups in their areas, in the dioceses. We now have, like in Bungoma, we have the flood victims in Budalangi and parts of Port Victoria, where the church again is involved through the Catholic Justice and Peace Program to try to help them, and where we are appealing for different agencies, different people of goodwill, but the church is in the front line. Secondly, the church is helping to disseminate information that is very important, so that we demystify these other social media where there is misinformation, fake news, so that people are able to understand exactly what they are called to do in terms of hygiene, in terms of social distancing, in terms of what they have to do in wearing masks and being careful staying at home. So the church is really involved, and I would say that from the background is giving very good support, to all the parts that are working, all the entities that are working. And for that reason, we are getting more and more involved as the situation unfolds. The church may have been accused that it was not cooperating much, but I think that is not the truth on the ground, because the church owns the health facilities that are at the grassroots. And this is where people probably report. And therefore, it's helping a lot in screening, it's helping a lot in advising.
Oh.
And therefore, the need for the government also to support these basic entities, health services, health institutions that the church owns, which are in the remotest part of the world, is how we are coming in to also to support even people living with disabilities. So the church is present.
Well, thank you very much, Bishop. The church is present and the church is on the front line. Thank you, because you're leaving us to go attend to other matters, and I'm sure you're leaving us with your blessings. But thank you so much for your contribution. The discussion still continues here on the Nation Leadership Forum, and I want to bring in very quickly Fozia Ali Kimanthi. Fozia, we are looking at all these issues that Gab has also addressed when you're talking about the PWDs, and there are 1.3 million Kenyans who are currently facing a crisis or worse levels of food insecurity due to the effects of this COVID-19. Father World Bank had previously reported that as many as 35 million Kenyans are excluded from quality healthcare coverage. My question then is, what measures can be put in place by non-state actors such as Safaricom to protect the vulnerable people in the society, especially during these trying times of coronavirus?
Thank you, Dennis. I think it's important for corporates to support government measures to ensure that any resources mobilized end up to the people who actually need it the most. So, for instance, Safaricom as well as other corporates are represented in the Emergency Fund Committee. The fund has raised more than 1.2 billion, and more than 50% of this has so far come from corporates. And this just goes to show how the corporate sector is committed to supporting the government towards provision of food and other critical services to be provided to vulnerable communities. Through our M-Pesa and Safaricom foundations, we have committed an amount of 200 million to the COVID-19 Emergency Fund, which we would like to direct towards cash transfers for vulnerable communities to help them address their basic needs. And we would like to do this, of course, using a certified database provided by the government. As an organization, of course, we are trying to ensure that the little money that is left in the pockets of our customers continues to go a long way in helping them where they need it most. So to this end, we have done a couple of things. We have zero-rated transfers on M-Pesa below 1,000 shillings so that we can save consumers of the transaction fees. We have also partnered with quite a number of county government health facilities in ensuring that they can be able to collect their revenues through M-Pesa. So we have waived all transaction fees when you're paying at these facilities. We have partnered also with members of the public service transport sector to try and reduce the use of cash. And so far, we have onboarded 500 public service vehicle operators across the country. And so far, we've seen over 13,000 passengers who are currently using this service. And this is helping quite a bit. But of course, quite central to most parents, they're concerned about the education of their children. Children have been home from the 13th of March. And quite a number of parents are worried about whether their children are going to be left behind in terms of meeting their learning objectives. So what we have done is that we are supporting learners to actually access learning content, and we are catering for all customers. For those who have data-enabled devices, we have partnered with three providers, that is Shupavu Web, Longhorn e-learning, and ViewSasa, so that our customers can be able to access this learning material for free. All they have to do is access a learning bundle on *544#. And for customers who do not have phones that have internet, they can actually be able to access quite a lot of material on primary and secondary education. Yes. On what we call a USSD channel, *291#. Of course, we've not left behind those who are going to university. There are quite a number of universities that have opened. I think most of them had about 2 weeks to close the previous semester. Quite a number have quite a bit of assignments. And we've seen a great need for them to access the education content for these assignments. So we have a university bundle for 10 GB that they only have to access for only 500 shillings so that they can be able to access the university content.
Well,
and we believe all these initiatives are there just to help Kenyans in this quite challenging time.
Thank you very much, Fawzia. We need to go for a break, but the takeaway from what you've just said is it has to work in partnerships. To fight COVID-19 can't be won through isolation and people just acting alone. But we're taking that break, and when we come back, we'll be speaking to Kate Maina Voli, the Country Director, Plan International. We're also going to be talking to the CS, Minister of Labour and Social Protection, Simon Chelugui. And of course, we're going to be talking to Kennedy Odede, founder and CEO, Shining Hope for Communities. So Nation Leadership Forum, this edition of COVID-19 and the vulnerable in society continues.
I also want at this point to specially recognize and thank the very many active community groups that are responding to the needs of their fellow citizens. I want to express my thanks to members of Shining Hope, communities, and I want to thank you all for the efforts that you are making to partner with us as government as we alleviate the stress that many vulnerable groups are going through.
Nyaja wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water, apply a small amount of soap, rub palms together, rub fingers and thumbs and the bits in between, rub nails on palms, rub the back of each hand, rinse with clean running water, and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of a respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Shawa ni sawa, ukishawa na sawa. Inakawia bana, inakawia Shawa ni sawa. Wazi yangu iko sawa, ninanukia vifiti. Rangi ya kupendeza bei, iko poa shing shing shing. Shawa ni sawa. Usisle kibana wetu mia sawa ushinde. Sawa all day. Kawia sawa. Sawa shawa. Au shawa sawa. Yote ni sawa.
Sour Shower has never been better with the new look Sour. Now with a new formulation too that will leave you feeling fresh for longer, while the soap lasts even longer.
Nyaja wa Kenya, hii ni public service announcement kuhusu coronavirus.
The Ministry of Health advises all returnees from abroad to self-quarantine for at least 14 days, whether they feel well or unwell.
Wash your hands regularly following the 8 steps of hand washing. Wet hands with warm water, apply a small amount of soap, rub palms together, rub fingers and thumbs and the bits in between, rub nails on palms, rub the back of each hand, rinse with clean running water, and dry thoroughly with a clean dry towel.
Furthermore, it is advisable to cover your mouth and nose adequately when sneezing or coughing and immediately dispose of the tissue in a dustbin. Please do not use handkerchiefs if you can avoid it. If disposable tissue is unavailable, cough into your elbow. Try and avoid close contact with anyone showing signs of a respiratory illness, such as coughing or sneezing.
Before you share any coronavirus information on social media, please verify it with Ministry of Health to avoid panic and alarm among your fellow Kenyans.
Birthday party.
Birthday party. Birthday party.
Birthday party.
Are we not invited?
We have gifts.
Malaria.
Mommy, pests.
Run.
Or die.
Party.
Compared to an ordinary spray, Mortein Doom Power Guard kills disease-causing pests instantly. Mortein Doom Power Guard.
Disinfect and protect your home with Jik. Jik kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jik bleach. Just Jik it.
Wajua wanasema food has memory, and those who nourish you are never forgotten. Unakumbuka the auntie who made sure you shibat? Ule jamaa wa nyama, ule anakuwekea nyama poa ya choma. The dere, happy to share your takeaway. Na huyo mama wa chai, ule ana warm your lunch before you ata uliza. Your mama mboga, ule anakuongezea ata nyanya. Ule waiter ukusava haraka haraka. Na ule mandazi lady, ule anakuwekea ndao moja ya baadaye. Na your boda boda rider, ule jamaa kufikisha haraka haraka. Now this is the time to let them know they are not forgotten. This is the time to make sure every table in Kenya has food on it. The points on your phone can be food in their home. When you sit with a plate of food today, pledge to stand for someone who has put food before you. Dial *126# to transfer your bonga points now so they can buy food and necessities at any outlet with a Lipa na M-Pesa till.
Safaricom is for you. This is NTV.
Tonight,
restaurants will operate between 5 and 4 p.m.
partial reopening of the wheels of the economy begins, but under strict controls. Plus, recovered patients sick and tired.
Tumekaa hapa sasa more than 21 days. Na nimeletewa bill ya 52. Sisi hatukuwa tunajua ati tutalipishwa.
Patients at Kenyatta University facility reject hospital bill.
Nimechoka kunyanyaswa mimi.
Also tonight,
if it may please my lord,
a judge, lawyers and jail. 4 locations united through technology.
The uniqueness is that it's the first case of its kind, to be held on using this electronic system.
There is a new world order, and so is the order of conducting court sessions. And the mirrors of hope in Mombasa's neighborhood walls.
Kutokana na hii hali ya janga la corona, nikapata fursa, nikaona ni idea poa nichore kuhusu vipi tunaweza peana message kwa jamii.
It's time to heal the world, so artists are going to work, and their language is paint, their homes the canvas.
Selena!
Toto, where is mommy?
Today's a toilet day.
What? Oh.
Selena!
Toilet day?
Tomorrow we're hosting a party and it's a matter of my reputation.
It's a toilet, not a white shirt. Even if you spend your entire day cleaning with bleach and detergent, it still won't be party ready.
Impossible.
Challenge. Harpic 10X. Even if you use bleach and detergent 10 times, they won't give you the same sparkling clean toilet that Harpic 10X will give you.
Wow!
Harpic 10X. Harpic, Kenya's #1 toilet cleaner.
Disinfect and protect your home with Jik. Jik kills 99.9% of illness-causing germs. Disinfect floors, kitchen and bathroom surfaces, and wash white clothes, towels, and dishcloths with Jik bleach. Just Jik it.
The risk of illness-causing germs is increasing. It is believed that the coronavirus can remain on surfaces in your home for up to 9 days. Touching infected surfaces is one of the ways in which germs spread. Regularly disinfect your floors, countertops, and kitchen surfaces with bleach. And use an effective toilet cleaner inside and outside your toilet bowl. This message is brought to you by Medifacts, Jig and Hapik.
Social distance, flexible work schedules, personal hygiene, cleaning and disinfecting work surfaces, and staying home. These are measures that in the era of COVID-19 can help to save lives and stop the spread of infectious diseases. Join the Directorate of Occupational Safety and Health Services as they tackle how health and safety at the workplace can help stop the corona pandemic. Tuesday, 28th April, 7:45 p.m. on NTV.
The risk of illness-causing germs is increasing. It is believed that the coronavirus can remain on surfaces in your home for up to 9 days. Touching infected surfaces is one of the ways in which germs spread. Regularly disinfect your floors, countertops, and kitchen surfaces with bleach, and use an effective toilet cleaner inside and outside your toilet bowl. This message is brought to you by Medifacts, Jig and Hapik.
When you're facing stubborn stains, you're always in a fierce fight, especially when others are fleeing away. However, with Cleasoft, I can make it so easy.
Cleasoft iko na 3 times particle energy to particles to blue husaidia kutoa mastain ngumu ngumu na ina enzymes za kulinda nguo zako ndio ziachwe zikikaa fresh.
Cleasoft kicks out stains kimateki.
Serious? Melissa? Mom, it's Dad's birthday today. I'm giving him a party just like he gives me.
Nothing makes a mother more proud than seeing her child growing up. But I know that as she learns to care for others, she'll face even more germs and the risk of illnesses.
That's why you need strong Dettol protection. Just 1 cup of Dettol protects your home and family from up to 100 illness-causing germs.
Growing up needs Dettol protection.
Welcome back to this special edition of the Nation Leadership Virtual Forum. My name is Dennis Okari, and we've been talking to our panelists here, COVID-19 and the vulnerable in our society. But just to quickly point out something that Honorable Mohamed Gabo, who is the Executive Director, National Council for Persons with Disabilities, noted earlier on about, missing our sign language interpreter. Mheshimiwa, I can tell you for the last 2 Nation Leadership Forums, we've had him. And today, for some reason, I think he went to grab a cup of coffee after the 7 p.m. news. But he's now back. We can confirm. You can see him. We're now back with David Agondoa. I actually had his name on my intro here, so it is just worth noting. But thank you so much for the observation. Now, to just continue our conversation, and I want to bring in Kate Minor Voley, Country Director, Plan International Kenya. Interesting, Kate, you mentioned earlier on about the dimensions of gender and the balance and the whole equation of how the United Nations has called out on the spike of domestic violence. Our own health CS Mutai Kagwe also mentioned observing that spike in the country. But I want to quote something. You recently wrote in an article, and I just want to read this, that girls from marginalized communities and those with disabilities are affected more by the secondary impacts of a pandemic due to their gender, their age, and accompanying factors with increased risk to FGM, gender-based violence, and child marriages. My question then is, what can be done by the society, and what have you done specifically during such times to protect the girl child?
Thank you. Thank you very much, Dennis. And that's a very good question. I think it's important to always create spaces for girls and young women to speak to us, to speak to decision makers, and to speak to policy makers, so that we better understand the challenges that they are facing. It's important that our health resources, in as much as they must be dedicated to fighting this pandemic, that they remain available for other needs that girls will have. For example, girls and young women do need access to sexual reproductive health rights. girls do need to be kept engaged in schooling. So we are very excited and happy with some of the initiatives that we've seen the government through the Ministry of Education rolling out with the Kenya Institute of Curriculum Development. It's important that we are also raising awareness on the specific vulnerabilities that girls face in this period. And these are not necessarily unique to the COVID pandemic. I think Kenya has not been blind to the fact that our girls have faced, as you rightfully said, female genital mutilation. They have faced sexual and gender-based violence. And when our eyes are turned to the COVID response, it is important that we keep one eye out for all the other issues that girls have been facing even before COVID-19. So we need to make sure that those referral pathways for reporting gender-based violations, gender-based violence are available, that caregivers and girls and families know where to report when there's been they've been sexually assaulted, where there's been gender-based violence. We can see that's on the increase because of some of the tensions we are seeing at the household level. Those pathways need to be there, and they need to continually be operationalized so that we don't lose sight on some of these realities. It's also good to be realistic and to acknowledge that there will be an increase in teenage pregnancies. And so what are we going to do to make sure that those services are available for the girls who will get pregnant? One of the things we say is that girls are now locked up with their perpetrators. And so the shining light, a light on those unique issues and those unique circumstances that girls and young women are facing is important. Essentially, we cannot tire of continually identifying what more stabilizing strategies we need to put in place to mitigate the impact of the pandemic for our most marginalized populations, and particularly for the girl child. The gender dimensions are real around the impact of COVID, and we need to focus on how COVID responses are also gender nuanced. Otherwise, we do run the risk of eroding all the gains we have made over the years, and this can set us back for many years to come.
Well,
we must make sure that the COVID response prioritizes the needs of girls and young women. Girls are not homogeneous, and they have unique needs, be it in those in rural settings have unique needs compared to those in urban settings.
Yes, Kate, thank you very much. Just hold on to that thought. Don't lose that. I just want to bring in Kennedy Odede very, very quickly. In your observation, Kennedy, some of the things that you've noticed in terms of domestic violence, have you observed cases? What is the silver lining in regards to strategic investment to the vulnerable communities post-COVID-19, especially in the areas which you directly engage yourself with, Kennedy?
Thank you so much, Dennis. And I think in the beginning you asked us about what the government is also doing.
Yes.
And I have to say that President, honestly, you can see his eyes. He really means well for the country, and people are letting him down in that. And right now, people in Kibera, Mathare are watching, and I'll be doing disservice if I don't say the truth. It's now raining. It's flooding in Mathare, Kibera. You hear the word social distancing. And when let's see that thing come from the Western world, that means that you live in a 2-bedroom house with a running water. You have nothing to eat. If you go out, you are being arrested. You are forced to buy a mask that costs 100 shillings. You have to choose between food and that. And then honestly, people are going through a lot of hell of this. And as the president said that people should adopt families, the government will do something, I'm sure. But I'm asking the middle class Kenyans, what are you doing? And what can you do for this? And for example, I can tell you, it's the same time right now people are also stealing money. People are also taking advantage. They don't want people to come with food in their community. Just because you want to give, no. Use the structures, use the existing community organization. Otherwise, you are spreading more disease. I have seen the power of partnership.
Yes.
With Safaricom, what we are doing in the community, and with AMREF. organization called Give Direct, that we are able to give 3,000 shillings to over 3,000 people in Kibera. And how do you do this? I grew up, I come from that community. We have the data of all the people through Shofco Urban Network. We go to the most vulnerable. We have their numbers. We have a technology that you go door to door and you can be able to see who received the goods. That's how we're able to give 400,000 soaps in our households.
All right, Kennedy Odede.
Another thing that we're doing, I know Kenyans are asking, how can I help?
Kennedy, thank you so
we
much.
We have a partnership with Jumia.
Kennedy, thank you.
In Jumia, whereby you can be able to go to Jumia and buy food that will go to the slums. And it will be done in a very structured way.
Well, Kennedy, thank you so much. Very, very passionate there. I just want to quickly bring in Kennedy. I just want to quickly bring in Honorable Mohammed Gabo and Mheshimiwa Gabo. Listening to what Odede is raising, those concerns and those challenges in the places where he has observed a number of these things, especially now with the floods. In closing, for you, the Inua Jamii program was recently set up to enable the cash transfers to PWDs, and kindly shed some more light on this and share some of the progress you have made this far, just briefly and in closing.
Thank you. The Inua Jamii program, we've been told about the old age and the orphans and persons with severe disability. I will ring-fence the persons with severe disability. One, we are using DPOs, chiefs. DPOs are Disability People's Organization, to identify for us persons with disability who at the moment are facing problems in terms of food. But what we are doing is that we've been instructed by our minister and our peers to make it easy that we do not distribute food, but partner with Safaricom, banks, and send the cash transfer in either way, in terms of sending them into money to the account, and also using mobile banking system. That will ease the problem. I agree with Mr. Odede. Problems are there for all of us.
Yes.
So we need synergy. We need to come together to identify the problems rather than complaining, because we will be complaining the government may not be able to do this or that. We need to take this as a new thing that has come to us, and it is it's causing problem to everyone. We need to make sure that we put our efforts together, and no shilling that the National Council for Persons with Disability or the Ministry of Labour and Social Protection is receiving will be used for other purposes. The money will be directly transferred to the beneficiaries. We have about 1,193,000,000 persons who are on cash transfer, as the Waziri has said.
Well, thank you, Mohammed Gabo. Thank you. You've just talked about Waziri, and I just want to bring him quickly. We're so pressed with time. Waziri, he has talked about, working with government, working with Safaricom. In closing and in a sentence, because of time, your commitment as government and as CS, Ministry of Labour and Social Protection, when you're looking at all these issues that Odede has also raised, in closing, what is your commitment as government?
Thank you very much. I think what Odede and the rest of the partners have said, we in government are committed to working as a team, working together to support the most affected in the society. We've seen a lot of input from these partners. Like, for example, Safaricom have waived some transfer fees to when we are dispersing money to the most affected. Recently, we sent over 8.7, and Safaricom actually waived over 5 billion shillings in terms of all the transfer fees, both for the vulnerable and also for those who are using cash, in terms of, because it's a guideline by our Ministry of Health. Other than that, you also know we are upscaling the National Safety Program, And we are again focusing, I've heard from Odede that there are issues in the informal settlements. However, there is a multi-agency program that is targeting the informal settlements in urban areas, particularly the lockdown counties of Nairobi, Mombasa, Kwale, and Kilifi. Wow. And already we have discovered, or we have already identified 108,000 households. And this will inform the strategy in upscaling the rest of the country. In view of that, we also have 138,000 beneficiaries who have been on the exemption list. And we were going to propose that through partnership, we are going to utilize part of the 10 billion to address those who have been in our list but have not been covered in the past.
Well, thank
so
you.
I want to
Thank
commit
you.
that...
Thank you, CS. I really, really hate to do this, but I'm so pressed with time. I wish you knew. But I want to go quickly in closing and just your commitment. And I want to speak to Fozia Alikimanthi. Fozia from Safaricom, your commitment in 30 seconds.
I think as our new CEO has said in the various addresses that he has made, Safaricom is committed to ensuring that our customers are able to go through this COVID-19 pandemic as easily as possible. We are going to do this by leveraging partnerships, but at the same time, we're going to leverage our core assets, our products and services, so that we can be able to deliver solutions to the society. And we are committed to doing this by continuing to leverage our network, our M-Pesa outlets, our merchants, our shops, our call center, so that we can ensure that Kenyans remain connected in this very, very difficult time. And once more in closing, kindly appealing to Kenyans to continue sharing their bonga points, because what we have seen is that over 50% of them are sharing their bonga points with other Kenyans so that they can be able to put a meal on their table. It's the difference between sleeping hungry and having a meal on the table. Kindly requesting all Kenyans who have bonga points, we know you have them, go to *126#, transfer your bonga points to a needy Kenyan. In conclusion, our technology teams are on hand to ensure our network remains robust, to ensure Kenyans continue to be connected to their friends and family.
Yes.
And we pray that we'll be able to return to normalcy in the near future. Thank you very much, Dennis.
Thank you so much, Fozia. Appreciate it. And now finally, Kate Maina-Voli, 30 seconds. I'm really pressed with time. Your commitment as Plan International.
Thank you, Dennis. I should have mentioned that Plan International is part of a coalition called Joining Forces Alliance, which includes World Vision, SOS Village, Child Fund International, Save the Children International, Terre des Hommes, and Plan International. As part of that coalition and as an individual organization in our own right, we will ensure girls, young women, children, and vulnerable groups are protected and supported as the COVID-19 pandemic unfolds. We have reprogrammed our whole country portfolio to respond to COVID-19, and we will continue our crisis response by focusing on communicating our public health information, installing and hand washing facilities, distributing hygiene kits for girls, and listening to girls. And above all, we will support our government efforts as they lead the national response.
All right, thank you so much, Kate, for that commitment. And Waziri Simon Chelugui, your commitment, 20 seconds. For the lady, it was 30.
We will support
Come again?
Oh, sorry. Waziri Chelugui, your commitment in 20 seconds as government. Waziri Simon Chelugui, your commitment, 20 seconds. Hello, Waziri, can you hear me?
No, come again, please.
Let's just go to Kennedy Odede, his closing remark in 20 seconds. Kennedy Odede, you've heard all the partners discussing this. What is your final remark, Kennedy?
Thank you, Dennis. I just want to thank the Kenyan community for what they've done private sectors, and just tell people that, for example, if you give Shofco any support, 50 shillings buys a mask, and 150 shillings buys a bar of a soap, and 1,200 will be able to buy a food for a family for a week. And Crime Power, our partners, and other people who have worked with us together, I believe together we can have an impact in this society.
All right, thank you so much, Odede. Mohammed Gabo, Mheshimiwa, your closing remarks, 20 seconds.
Thank you. For me, persons with disability, we need to ring-fence specific resources for them. It is very important that they are taken as a sector that needs our help, and then we make sure that the chiefs, DCs, county commissioners, that persons with disability cannot walk to you, kindly go to their homes, check for them, and I appeal at least 30% of the resources for this COVID-19 to be reserved for them. Thank you.
Well, thank you. Thank you so much, Mheshimiwa Mohamed Gabo. Now, let's just wind this up with CS Simon Chelugui. CS, your commitment as government in 20 seconds, your closing remarks.
Yeah, thank you very much. I want to thank first all the partners who are involved. First, my colleagues, Ministry of Finance, Ministry of Interior, Health, who have worked with us to ensure that we deliver the cash transfer to the most affected in our society. I want to thank everyone who has sacrificed and contributed. As you've seen, our president, the deputy, the ministers, and all of us have sacrificed even in reduction of our salaries to ensure that we support the most affected in the society. So I believe that together we will overcome this challenge. I want to urge all Kenyans to ensure they comply and follow all the guidelines issued by our Ministry of Health, ensuring that we sanitize, we wash our hands, maintaining social distance, and reduction or cessation of movement. This way, we will be able to control the effects of this problem. However, we are urging everybody to sacrifice, to contribute, to help where possible, so that together as a country, we will rise up once more and rebuild our country, which we love so much. Thank you very much.
Well, thank you very much, CS. Couldn't end it any better. Together we will overcome this challenge. To our panelists, thank you so much for taking your time and your partnerships as well. Simon Chelugui, CS, Ministry of Labour and Social Protection. We also had Mohamed Gabo, who is the Executive Director, National Council for Persons with Disabilities, Kate Minor Voley, Country Director, Plan International Kenya, Kennedy Odede, Founder and CEO, Shining Hope for Communities. We also had Fozia Ali Kimanthi, Head of Digital Products and Services, Safaricom PLC, Joseph Obanyi Sagwe, Bishop Catholic Agency for Overseas Development. Thank you so much for watching as our viewer. We are going to take a short break, and the 9 o'clock news will be beginning shortly. My name is Dennis Okari. See you next time on the next edition of the Nation Leadership Forum. Remember, the conversation continues with the hashtag NMG Leadership Forum. Good night.